Welcome to the Your Oxygen Mask First podcast. I'm Erin Young, and this is a space where we explore ways to help the helpers. Because you can't help anyone before you help yourself. So sit back, put your own oxygen mask on, and enjoy the ride. Thank you so much for joining us again. I am very excited to be extending our deep dive series on suicide prevention for veterans. And not only for veterans, but your average everyday person can learn something from some of the resources that we've provided. And I am honored to be joined by Dr. Blaire Schembari, PhD. She is a staff psychologist for the VA San Diego healthcare system. And I think some of what she'll talk to us about today can resonate not only with veterans, but everybody can take something away from what she has to say. Dr. Schembari is an expert suicidologist. And I've never heard that term before, but she's going to tell us what that is. She's committed her career to learning more about how to prevent suicide. And I'm very grateful for her to be here. Thank you so much for joining us.
Thank you so much for having me. It's really an honor to be here.
Let's start off and talk a little bit about yourself, your personal history, why you decided to study psychology.
I just kind of in a nutshell, I was actually born and raised in Las Vegas, Nevada, which I know is kind of odd for some people. Not a lot of people know that people are from Vegas. And I spent pretty much most of my life there until college when I went to undergrad at UNLV for a few semesters and then actually transferred to Loyola Marymount University in Los Angeles. I started out actually just being kind of one of those undergrads who's really interested in psychology. I think it's a typical story for most people. They take their first general psych class and they think, wow, this is really cool. They learn about some of the really interesting early studies that psychologists did, and it draws them in. And I kind of was no exception to that. So I was really interested in understanding human behavior, the human mind, and just getting a better sense of why we do what we do. So that ultimately drew me into majoring in psychology. And then it was actually really interesting. So I was, I think I was a junior in college at LMU. And I took a death and dying studies course. And there were not many people in that class, as you can imagine. Not many undergrads want to learn about death and dying. But for some reason, it was really interesting for me. I took this class and it was a really, really amazing course where it was a Tuesday, Thursday lecture format. And on Tuesdays, we would be in the classroom learning about a specific topic under the umbrella of death education and death studies. And then on Thursday, we would actually go into the community of Los Angeles and we would engage in some type of activity that related to that topic of the week. And I will never forget, we actually had a lecture week on suicide. And that Thursday, we were taken to the Los Angeles Suicide Prevention Center, which I'm not sure how many people may know this, but the LA Suicide Prevention Center was actually the very first crisis hotline for suicide in the nation. And so I had an opportunity to go there and to meet with their, I'm not sure what the title is, but kind of their director of training for volunteers to work on the crisis lines. And right after we had visited the line, my professor pulled me aside. And I noticed that he didn't do this with any of the other students, but he pulled me aside and he said, Blaire, I think you need to volunteer here. And I kind of laughed and thought, I'm the social chair of my sorority. What are you talking about? I'm 20. I don't know. What do you mean that I could do this? And I kind of took a couple of days actually after that and reflected on what he said. And I thought, maybe he's kind of seeing something in me that I don't really see in myself. And that might be an important thing to take a look at. So I ended up actually volunteering at the Los Angeles Suicide Prevention Center for about 6 years. Actually, I started when I was 20 and became a supervisor on the hotline. And the experiences that I had talking to people who were acutely suicidal was incredibly life-changing for me. It was wildly humbling, and it gave me a path in my future and my career that I never knew would have existed. It ultimately inspired me to go on to earn my master's degree in psychology, and then ultimately to go on further and earn my PhD in clinical psychology. And so far so that I actually pursued working and was able to work under the mentorship of David Jobs, who is a world-renowned suicidologist who I studied under for many years and am honored to now be a colleague of his at this point. So Yeah, that's kind of my path. It's kind of an interesting one, but I wouldn't have changed it for the world. I absolutely love what I do.
That is incredible how you just kind of fell into that path and has made that topic, that niche, made it something that you're so passionate about that you had no clue you were even interested in at the time.
Yeah, absolutely. I still marvel about it. I honestly think about it at least a few times a year when I reflect on just kind of where I've been and where I'm going in my career. And I think about it and I remember that I actually remember there was a specific call that I had with a specific person, and it was a really intense situation. This caller had consumed a large quantity of alcohol, was very intent on dying by suicide, had prepared multiple plans that were right at his fingertips to be able to use. And I had my wonderful team. My supervisor was with me the whole time through. We had a great instant messaging system kind of guiding me. And the end of the call, I was with this caller for hours. And at the end, ultimately, through the conversation and through, I think, just the connection that this person and I had, ultimately, he did report that he didn't want to die, that he felt he could get to himself to a hospital, that he removed the means that he had, essentially, kind of made them more difficult for him to have access to. And he said to me that I saved his life. And I not didn't laugh because it's not a laughable situation, but I kind of remember noting that. And I said to him, I didn't save your life. You saved your life. I was like, I was just here on the phone kind of guiding you, but ultimately you made the choice to save your own life. And I remember going home that night and kind of trying to unwind because my shift was from 8 p.m. to midnight. And so I couldn't usually go straight to sleep afterwards. So I took like a hot shower and I remember thinking about how I loved so much that how things turned out that evening. And obviously they don't always turn out that way, but I loved the experience of connecting with another person at their most difficult time. And that through that connection was able to learn about myself, but also to help this person empower themselves to ultimately save their own life. And it gave me something that I thought, gosh, I don't know if there's any other job that's ever going to give me this type of feeling. And it was kind of in that moment that I was like, okay, this is it for me. Like I've found like the love of my life in my career, so to speak. And I never turned back.
It's hard to get off that high when you build a rapport with someone and you affect them for the better and ultimately may even save their life. I'm a 911 dispatch supervisor. I've been doing it for 14 and a half years. And I can feel that connection with certain people and certain calls. So I totally understand what you're talking about. And I wish more people could understand the power of the connection and power of rapport, even in our everyday lives, especially with the political climate and how, just kind of hostile I notice, even just in casual conversation and just life itself has become so negative lately.
I agree. I think the rapport is everything. And I think that's, the biggest thing that I learn and every day try to remind myself is that like, I'm a human being, right? Like I'm not perfect. I'm not always going to be at my best. And the same with everybody else. And I think that it's the human connection. It's another human connecting with another human. And it doesn't take much to change my circumstances to put me in a situation where I would need someone to do what I've been able to do for so many others. And so for me, that's just kind of the ultimate connection to have with other human beings. And I truly value it each and every day.
So we mentioned earlier that you are a suicidologist. Can you explain what that is and what you do?
Yeah. So suicidologist, the term is kind of a larger umbrella term that incorporates individuals who are essentially clinicians and researchers that are working together for a common cause of being able to prevent suicide and also just ultimately to study suicide. So the experience of suicide, the expression of suicide across different people is an important topic area because it all lends itself to ultimately understanding risk, prevention, different interventions, and so forth. So suicidologist I think it's a pretty cool term myself. And I think it's a nice way to capture a specific subgroup of people who really focus primarily on further understanding the phenomena of suicide.
Do people react in a certain way when you tell them that that's what you do for a living? And
oh, yes.
especially you're such an upbeat, happy person. And then you say, I study suicide for a living. What kind of reaction do you get?
Oh yes, I've had all sorts of reactions, especially because I've been doing it since I kind of considered myself being in this field since I was 20. So for the past 12 years, this has been my area. And so yes, I kind of laugh because I can distinctly remember a few times in my early 20s when I was doing this, and I was single at the time, and you'd go out and you would meet people, and I lived in Los Angeles, and so you'd meet other people and they would say what they did. And typically I met a lot of writers and actors and directors and things like that. And then I would share what I did. And I definitely had a lot of people actually just say, I don't really know how to talk to you. And they kind of just would walk away. And I was like, okay, well, that's probably a good way to kind of clear out maybe who can handle this, who can't. But yeah, I mean, I definitely, for the most part, I do get a lot of people who go, oh, wow. And I think it lends itself to the idea that people really are still very much not comfortable with talking about suicide. And I always kind of, as a kind of an icebreaker to my veterans whom I work with on a clinical capacity, whenever I introduce or ask about the topic of suicide, I kind of jokingly say, I'm actually more comfortable talking about suicide than I probably am talking about anything else. And they kind of laugh, and it breaks the ice a bit because I want to let them know that I'm not afraid to talk about this, because even my own veterans have sometimes a little bit of a jarring reaction of, well, how do you dedicate your life to this very seemingly morbid and seemingly dark area? And I don't even see it that way. I don't see suicide prevention work as dark and morbid. I see it as incredibly hopeful, uplifting, empowering, and important. So yeah, but I get the reaction of the, ooh, okay, next topic. Let's talk about something else.
They definitely don't ask you about your day at work then.
Yeah, I mean, I think some people are like kind of fascinated, but other people are like, just, well, that seems terrible, and let's move on. And I try to give them as without sounding kind of, annoying, I try to give them a little bit of education of like, no, actually, this is a really important thing to talk about, and it's not scary, and it's, a lot of people have these thoughts, and it's okay, and we can talk about it. And this is the way that we actually can prevent it, is by having an open conversation about it, rather than shying away from it or having that type of a reaction.
Yeah, I think when you talk to people about suicide, it kind of puts a mirror up in front of their face, and they may not want to openly admit or even agree with you that suicide prevention is great, because they may feel like they're admitting to something that they don't want to talk about.
Yeah, that's an excellent point. I certainly could see that being the case for many, many people.
So let's talk about some of the research and some of the work that you've done.
Yeah, so I have, had, like I mentioned earlier, when I went into my PhD, which I earned from the Catholic University of America, which is way out in Washington, D.C., I worked under the mentorship of David Jobs, who I mentioned is a suicidologist. And the largest portion of my research actually took place while I was getting my PhD. And I actually spent my time researching a pretty remarkable intervention, and, well, I should rephrase that, a pretty remarkable clinical framework that my advisor, Dr. Jobs, developed. It's called the Collaborative Assessment and Management of Suicidality. The short acronym is CAMS. And it's essentially a therapeutic assessment. It's designed to be able to help understand and come up with a plan of treatment to address a person's suicidal thoughts, feelings, wishes, intents, desires, and so forth. And really briefly to explain it, it's basically, there's a form that you fill out alongside of the patient once they've reported any suicidal thoughts. And the form takes them through a variety of different variables that are all rooted in suicidology theories. So different understandings of why a person may be suicidal, or how certain risk factors will relate to overall risk. It's what we would call a mixed methods approach. So what that means is essentially there's numbers that you rate your experiences on the form, and then there's also kind of open-ended questions that you can actually write in your own responses, so direct from the patient's kind of thoughts. And basically this the CAMS framework takes a person through a treatment planning phase to ultimately identify kind of what is driving them towards wanting to die by suicide. And it helps a clinician in the sense that it enables them to be able to identify the targets for treatment so that you're able to better address the overall risk of suicide by basically addressing the things that the patient is saying is making them want to die by suicide the most. So a large portion of my research has actually been centered on examining that specific form within the CAMS framework. And that form is called the Suicide Status Form, the SSF for short. So a lot of my research has looked at being able to just kind of understand the suicidal mind a lot better through the suicide status form, looking at a variety of different variables. And largely, I spent a good portion of my time examining suicide status form responses across different cultures. So my dissertation actually looked at 6 different nations of responses to the suicide status form, and just trying to very, I think, delicately understand, what are some similarities, what are some differences that we're seeing being extracted in how people experience and express their suicidal wish across different cultures, to get a better sense of just any type of diversity that we may see with these responses.
Was there one common thread or many common threads that you guys found?
Yeah, so by and large, so our sample, there are always limitations to research, and this study was no exception to that. But our sample definitely, we saw a lot more responses. You could kind of easily categorize it almost from our individualistic cultures versus our more collectivistic cultures that we had samples of. And so you could kind of even see things like, for example, perhaps a reason for dying for one of our individualistic cultures would be something to do with, I'm not progressing in my career, or I hate myself, right? Kind of a very internal and individualistic perspective. And then you could look at the other cultures who had more of a collectivistic kind of perspective, and they would say certain things like, I wanted to die by suicide because I've brought shame to my family, or because, I'm not going to be able to contribute to society the way that I should be able to do, or so forth. So we kind of found, interestingly, that the expression, for the most part, tended to map on pretty accurately to what we would see in terms of our individualistic and collectivistic cultures. Mm-hmm. And there were a lot of other kind of really specific nuanced results, but I would say by and large, we found that overall, and that was pretty, I think, interesting to see, because there's pretty limited amount of research on suicide and culture. So.
Does it vary by gender?
That's an excellent question. One of the limitations of my dissertation specifically was that I didn't actually have gender for all the different samples. So I had it for a few. So I actually wasn't able to compare that, but I do suspect that it most certainly would. And I think in other findings that we've looked at within the CAMS kind of research empire, we've been able to find some pretty interesting differences across gender, as well as age group. So yeah, I wish we had that. That would have been really cool, but it's one of those things. When we do it again, I'll get a big budget and be able to do it.
There you go. Any anonymous donors listening out there?
Please. I wanted to actually mention just kind of a recent research project that I'm starting up at the VA. It's based off of, it's actually in the spirit of suicide prevention. It's really, that's the kind of the end goal. It's called Caring Cards. And it's a project I started at the VA when I was a postdoc at the San Diego VA, and I'm carrying it through as a staff member. And basically, it's based off of Motto and Broadstrom's Caring Letters for Suicide Prevention, which very briefly is a beautiful, simple intervention that staff members and researchers will send out letters to individuals who discharge from an inpatient psychiatric unit following suicidal ideation or attempt. And the research has demonstrated that receiving these letters once they've discharged actually significantly reduces suicidal risk, readmissions to hospitals, and so forth. And it's very, I just love that the simplicity of it, but yet the caring aspect to it. And when I was a postdoc, kind of thinking and observing kind of, the veteran to veteran connection, I developed this group within the clinic that I work in that's called Caring Cards. And what we do is the veterans, from start to finish, they design They write messages of hope and empowerment in these cards, and these cards are then mailed out to to veterans, who are leaving our inpatient unit in San Diego, who came in for suicidal ideation or intent. And we're still the cards have been created, and we're still in the beginning phases of getting approval to send out these cards. But the plan is to be able to track the veterans who receive them, and essentially see if they're enjoying receiving the cards, and then looking at their medical charts to see if these cards are actually impacting their overall risk of suicide. Are they contacting the crisis line as frequently? Are they having interactions with emergency services for suicide as frequently, and things like that? We suspect that it's going to have an impact. And what I love so much about this project is that, it's there to help other veterans who are leaving the hospital. But the veterans themselves who are actually creating the cards, they themselves have been on our inpatient unit, and they themselves have struggled with thoughts of suicide. And I have had many of them report to me that just the fact of making the cards actually does help them when they are experiencing an increase in symptoms or any thoughts of suicide. It helps them to cope better, knowing that they're able to do something and give back to their fellow veterans in a creative kind of and hope instilling way. So I'm really proud of that project, and I hope that we'll have a lot more to share as time goes on. But that's just something that I don't know. I'm pretty proud of it, and pretty proud of my veterans who are a part of it as well.
That is absolutely phenomenal.
Thank you.
And you're going to have to email me and let me know what happens with it. Or maybe we'll have you back on the show with an update, because that is just an amazing idea. So now that you've done so much research and spent so much time in the field of suicidology, have you yourself or anybody close to you struggled with mental health challenges? Maybe not suicide in particular.
Yeah. So mental health, in my humble opinion, it's like the common cold. Like it's so prevalent. And again, it's very sad that people don't talk about it a lot more, because I think if we did, we would actually understand that a lot more people struggle with it than we think. And I think it's important to be able to acknowledge that, as a kid, I actually struggled with a lot of anxiety all throughout middle school and high school, which also was coupled by a few periods of depression. And the best thing that I did was talk to my parents about it. And they helped me connect with a therapist who I actually only went to for a couple of sessions. I kind of wish that I had gone a little bit longer, but it was kind of all I needed. And honestly, what she told me was that this is incredibly common, and this is not something to think that it's not permanent. It's going to go away, and gave me some really good tools. Some reading and learning a little bit about it was ultimately what helped me to be able to know that this was not going to be all of me, but maybe just a part of me that I could absolutely work through. And, I certainly have had my fair share of other close friends and family members who've also faced mental health difficulties. And I've just found an observation, of course, that having someone in a safe space to talk to about it and not be judged for those experiences, and know where to get resources and help, and really having an opportunity to learn, I think is an incredibly powerful aspect to recovery in that way. So, yeah, I think for the most part, in fact, most of my friends and family have at some point dealt with some type of mental health concern. And I've certainly lost some pretty close friends to suicide myself after the fact that I had gotten involved. And each year, actually, when I do one of the Out of the Darkness walks, or one of the walks for suicide survivors, I always very proudly wear a pin and badge for them to represent, to let others know that just because I'm a psychologist and I'm a suicidologist doesn't mean that I'm immune to losing loved ones to suicide as well.
And that's got to be hard for you, because you're entrenched in this topic all the time.
Yeah, it certainly can be. And I think, though, that for me, it's more about the inspiration of those that I have lost to suicide, to being able to say, this is why I'm doing this. And that, and being able to have an opportunity to contribute to the research, to contribute clinically, and even by doing podcasts like this, which I think is outstanding, because having an opportunity to talk about suicide and mental health issues in a very open forum, I think all of these things is kind of what drives me, is thinking about those that not only I've lost, but I'm sure many others have as well. It's important to let them know that even though they are gone, that we can still be a voice for those who are continuing to suffer. And it's actually quite inspirational for me.
Absolutely. I wholeheartedly agree with that. And thank you for being a voice for people that can no longer speak for themselves.
Thank you.
We've already talked about some of the tips and the things that you wish people knew about suicide. Is there anything that does stand out that we haven't talked about wanting people to know about mental health or suicide?
The biggest thing, and I think this actually ties a lot into, and it's been on my mind a lot because I've been working in the VA now for a little over a year. I have noticed a big misconception that people have either about suicide or mental health issues is that if they have these experiences, it means that they are a weak human being, that there's something inherently flawed within them, that they aren't strong enough to overcome this. And I think that that's a really unfortunate kind of perspective to have, because these experiences, again, they don't mean that you're weak or that you're flawed or that there's some deficit. It actually just means that you're a human being. You're not alone in this experience, and that there are so many others who will go through similar experiences, and that you don't have to suffer through this alone, and that we aren't perfect as humans. And I think you even alluded to earlier, just kind of the overall negative culture that is going on in our world right now. I think that there's more pressure out there on so many levels. And I even think about the youth today, and I think about, the pressure when I was growing up. Going to college was, it was kind of expected in some ways, but it was also still very much a luxury. And like, my parents didn't go to college. And so going and getting my bachelor's degree was a big deal in my family. But now, youth these days, they're expected to get master's degrees and maybe even go beyond that. And there's so much pressure, and our society is moving so quickly, and there's a lot happening in the world right now that I'm not even sure we can really fully comprehend as quickly as it's all happening. And so there are more immense pressures, and I think we're seeing rates of suicide increasing. And I often think it has to do with this idea that people think that, well, everyone else seems to be doing fine and I'm not, so I can't talk about it because I'm clearly the one who's flawed or I'm weak or whatnot. That can be very troublesome. And I think adding in social media to it, right? You can have these like beautiful Instagrams and Facebooks where you look like you're having the most perfect life. And so other people see that, and it's even more difficult for them to come forward and kind of admit that there's something that's not going on. But maybe they don't realize that the person with the perfect Facebook or Instagram is also suffering. So I think the thing I really wish everyone would know is that, you are not weak. This does not mean it's a weakness. This is just something about being a human being, and that you are not alone in this, and you can connect with others and work together to overcome it.
Mm-hmm. Yeah, there's absolutely no shame in talking about this, especially opening in. I think a lot of people think that not only do they will be viewed and judged as a weak person, but they may also lose their job or lose some of the freedoms that they have because they are having these thoughts.
Yeah, exactly.
And I never once thought, raising children, that I would ever have to talk to my 8-year-old and my 10-year-old about suicide this young in life. But we've had many conversations. My 10-year-old actually had a schoolmate that was suicidal. And before we'd even had a talk about what suicide is, she comes home and starts talking to me about, my friend wants to kill herself. What does that mean? What really is death? And like, so we had to go into all these things. Now, me doing this podcast, they're very much well versed in age appropriately, I have to say, but in what suicide is, and what do you do if someone says that they want to hurt themselves, and what happens if you hurt yourself. Too bad, you're not coming back. It's not like a video game. You don't get an extra life. And trying to put it in that realistic perspective has been challenging, but I'm grateful to be able to give them that information, and horrified at the same time.
Yeah, absolutely. I'm so glad that you're doing that with them, and I feel like they're very fortunate to have an opportunity to learn from you for these very serious topics. And my fantasy is that like one day all schools will like have this as like part of their core curricula, because it's, unfortunately, this is where things are going, but it is so important that we talk to our kids about this in, like you said, a very developmentally appropriate way.
I mean, they have sex education at certain ages. You might as well just throw, mental health and also suicide awareness too, because I think at the younger ages, they also need to learn self-care and identifying when they're feeling these feelings and why they're feeling these feelings and how to put a label on it, because I feel like kids really can't cope too well if they can't articulate what the label is on what they're feeling.
Exactly. That's exactly right. Yeah, I completely agree.
So from kids to veterans, a big, huge topic jump, but now that you're working with veterans, what are you finding that's unique about working with this type of group of people when we're talking about mental health and suicide prevention?
Yeah, and I actually think this piggybacks really nicely off of kind of what you had just said about being able to kind of label your experiences. And I think the biggest challenge that I've had, and I shouldn't necessarily say challenge, but I think it's been challenging and also incredibly rewarding at the same time. But it is, I think, a very unique thing to the military population or veteran population, is that military culture is unlike any other culture that we encounter kind of as civilians in our day to day. And this is very, I think, relevant. Just last week, I was running a group and I was speaking with a group of veterans just about their experiences in the military and mental health. And they had basically stated that, and I've heard this many times before, but what's interesting about being going from the military to being a veteran is that when you're in the military, you're taught to never complain, right? Like you never let anyone know that anything is going on. They even said, the group of veterans said, like you cut your leg open, you go get a Band-Aid and you like keep going. Like you just you don't even go to medical. You don't want to risk any idea of like not being able to continue on or anything like that. So basically, you don't complain about it. And it goes the same for mental health issues as well. You just don't talk about it. And then when they're discharged and they're getting reintegrated back into civilian life, they are given so many resources and outlets to be able to talk about it, right? To say, here's the Veterans Crisis Line, here are all these different mental health services, take advantage of it, talk about it. We want to make sure, which I think is phenomenal. I'm so happy that we have those resources. But what I hear from my veterans is that there's this disconnect between they're given a message in the military and understandably so in certain situations, for example, like, not letting anything interfere with the mission, right? So in certain cases, I understand how that message is given. And then they come out and then the message is very different. And for many of them, it's quite confusing. Many of them may be struggling with mental health issues and they don't really even know how to talk about it because it's been part of their culture to not talk about it for so long. And here they are with people, asking them these questions that they're not even sure if they can trust them. They're not even sure if they should say anything. They're not even sure if they wanted to say something, maybe even how to say something. And so being able to, you hit the nail on the head, Erin, when you said like being able to label these experiences enables you to then be able to cope. But for many of the veterans, I think that they continue to have a difficult time labeling what the experiences are. And so part of our job is not only to be able to provide them, with the skills, with the coping tools to be able to manage through, but also to be able to help them to kind of accept that they're experiencing a mental health concern, what that means, how to label it, how to talk with their family, maybe their friends about these concerns. So it's a much larger kind of educational perspective to take, but also all the while being empathetic and understanding kind of the differences in military versus civilian culture and the messages that our veterans are receiving kind of when they leave the military and come into the VA. So I find that to be a really unique aspect, particularly of veterans.
Because you can give them all the pamphlets, flyers, brochures, and resources, but if they don't know how to actually take advantage of them or how to apply what they're learning, you're not going to get anywhere with them.
Exactly. And I mean, even something subtle and nuanced, like, maybe they just notice that they're sleeping a lot more and they're more irritable. I mean, they might not know that those may be some signs of depression, right? And they don't know that. Or they could say, oh, well, that's just me being upset and I just need to shake it off and pull myself up by my bootstraps and move on. But, being able to help them even and kind of have a more internal observation to say, oh, okay, wait, this actually might be a warning sign of something larger that's going on. And it's at this point that I do need to inform, my friends, family, my providers and things like this, take advantage of those brochures. So it's almost like kind of having to learn about themselves, which is it's a challenging process to do, but a very worthwhile one in order to help connect those who need help with the help that's out there.
And I bet a lot of them too, they don't realize that it would happen to them. Oh, that'll never be me. I'll be fine.
Right, right. Or they don't see the extreme case. Like they'll see the extreme cases in maybe their friends or the people that they hear of. Like, oh, well, one day, they think, well, one day, he was fine, and the next day he died by suicide, and there was no warning sign. But we all know that there are typically, warning signs. But whether those are shown or whether we know how to pick up on them is one thing versus another. I think it just goes back to being able to understand that even though you're a soldier, you're still a person, right? You're still a human, and there are still going to be bumps in the road along the way. And that doesn't mean that there's something wrong with you. It actually just means that you're, again, just a person. So,
and a person that has seen possibly some of the most horrific things that no other person other than the military has been experienced to. So, you've got to take a look at stuff like I've been through some stuff, and it's okay for me to get that out, because I feel like the military, especially some that I've talked to, they kind of brush off their service like it's no big deal. It's I just did my job. I just did what I had to. But these guys are men and women are very special. It's expected that you're going to be having these feelings. We're going to expect that you're going to come home and things are going to change for you. You need to expect that of yourself too.
Absolutely. And I completely agree with that. And I was thinking as you were talking about, this is so relevant for our new vets who are returning, but it's also really relevant. I've seen it quite a bit in other veterans who are older, who none of their symptoms really start to kick in until they retire. And it's typically, they serve, they come out, then they start working, they're in the community, they have their family, they have something to occupy themselves with. And then it's around, 65, 60 years old, all of a sudden they're not as busy, they're not doing as much. And then all of these kind of symptoms that they've been kind of pushing down or ignoring or just getting by really come to the forefront. And then at this age, they feel even more kind of lost as to how to address this and how to deal with this. And that can be even more difficult too, because I think that, when you're older, you're kind of seen as, this maybe wiser person in your family. And now all of a sudden you're kind of needing to relearn who you are in an instant. And I think that can be a very difficult transition as well.
So, what resources would you recommend for these veterans, or really anybody who's struggling with suicide loss, trauma, or mental health challenges that you can point us to?
When I think about resources, I have to admit that being a perpetual student, I have moved around quite a bit. And so whenever I've been in a new city, I've kind of learned some of the local resources. But I, for the most part, because I've traveled around a bit, have really become connected with some of our more national resources. So I certainly, first and foremost, when I was working on the Suicide Crisis Hotline, I was part of the National Lifeline. So I highly recommend, for anyone struggling with suicidal thoughts, and even for friends and family who have someone in their life who is struggling with suicidal thoughts, and you really don't know who to turn to, how to ask some of these questions. I don't think many people realize that you don't have to be acutely suicidal to call the Lifeline. You can actually be someone who's interested in learning more about how to talk to someone who is suicidal. So calling them, their 24/7 hotline. I know from firsthand experience that everyone on that line is incredibly well trained. It's our 1-800-273-8255, which for kind of moving into the veteran arena, it's the same number for veterans, the Veterans Crisis Line, but veterans would push the number 1 when they got to the main menu of that. And that, again, I think is a wonderful resource to be able to have really anytime, day or night, to be able to talk with someone live. I also find the American Foundation for Suicide Prevention, AFSP, to be a phenomenal resource site. They have very easy to read, consumer-friendly materials, resources, facts on their website that anyone can access, as well as the American Association of Suicidology. Their website is suicidology.org. They also have a phenomenal list of resources. They include things for the LGBT community. They include things for teens, youths, the elderly, different readings that are available, different even trainings. I think on one of the episodes, someone mentioned kind of our assist training, or kind of a QR QRC training, I think. But anyway, yeah, where you can basically learn how to have a conversation with someone who's suicidal and being able to ask specific questions to help them to understand their risk and being able to point them in the right direction of different resources. I also have had a lot of great experiences using Befrienders worldwide. It's BEFRIENDERS.org. And they're actually an international organization that can help people who are all over the world being able to cope and understand and work with suicidal ideation and experiences. I think 211 is obviously just a really great place to get information on treatment, as well as SAMHSA, the Substance Abuse and Mental Health Services Administration. They have a great treatment locator feature on their website that can allow you to really narrow down specific types of interventions and help that you're looking for. It even goes as far as looking at different insurance providers that you have and zip codes and what preferences you may have for treatment as well. And then lastly, we have a really great resource specifically for military veterans, which is called Making the Connection. And that has a variety of different videos and resources on there about helping veterans get connected with care. And what I like about it is that there are videos that are created by veterans speaking to other veterans. And I always find that when a veteran can connect with another veteran, it's a much more powerful connection, I think, than when someone like myself, I might have degrees and, research and what have you, but I don't have the personal experience that another veteran shares. And so I can talk for days about why treatment is helpful. But when another veteran says it, it clicks because they experience it. And so Making the Connection has some really phenomenal resources for veterans as well.
Well, thank you, Blaire, so much for joining us. I really appreciate having you on. All of your amazing research and treatment and ideas about how to kind of spin our world for the better are just phenomenal. Thank you so much.
Thank you. It's been such a pleasure. And thank you for what you do, Erin. This is a phenomenal platform. And I think that all providers and consumers alike should really be listening to this show because I think it really opens up your mind and has a lot of wonderful perspectives on kind of mental health. And really, I think we're breaking the stigma here by being able to talk about it openly.
Yes. Seeing your therapist should be just like getting your hair done or getting a haircut.
Yep. I always equate it to the gym, right? You go to maintain. So why not?
Thank you so much for taking the time to listen today. And I hope that you found something that really resonates with you. I can't wait to share even more. So please subscribe to the podcast. And you can find links to our resources in the description and at youroxygenmaskfirst.com.